And welcome back. Well, today is the first day of National Public Health Week, and when you think about healthy communities, nobody goes it alone. You need to find the right support.
Absolutely. And joining us now is Coreen Dicus-Johnson. She's the president and CEO of Network Health, which offers customized commercial and Medicare health insurance. Great to see you.
Good morning. Thank you for having me here.
Yeah. Absolutely. And this is a great time to be talking about this because you made the point to us that it's National Public Health Week, which is the 1st of April, April Fools through April 8th. And the theme is about healthy communities, right?
Yes, yes, and it's not a fool's joke. I really mean this. Yes, you know, Network Health, we are really focused on our communities because we're Wisconsin-based. We live and work in the communities that we serve, and so we have a real active interest in making sure that our communities have access to the best care and the best partnership and collaboration.
I love that.
So what would be a health insurance's role in making a healthy community? How do you see that role?
Well, we see several roles. First one is probably making sure that we help them with their healthcare costs.
Yeah.
You know, healthcare costs are rising, and everybody needs help doing that. But also making sure that they have access to things that can help them live a healthy life. We do this by collaboration, partnership, and when we talk about collaboration, what we mean is we work closely with their physicians and the healthcare systems that they see for services. And I've got a great story to really illustrate that.
Oh, yeah.
We had a member who was in the hospital several times, probably more than you would expect them to be in. And our chief medical director noticed this, and he reached out to the physician at the hospital. And he said, you know, what's going on? They sat down together, they went through the medical records, and they determined that this particular member didn't get his medication that he needed.
Oh.
The reason why? Because he couldn't afford it.
Yeah.
And so what they determined was he was embarrassed. He didn't want to tell his physician that he had trouble. We brought our pharmacist in. The pharmacist was able to identify a more cost-effective medication, worked with the primary care physician, and they were able to make this affordable. And so that's a real good story that illustrates our actions in collaboration and partnership.
Everyone.
It really does.
At the end of the day, every single person is going to benefit in that situation.
Precisely, because the physicians that we work with see us as partners. We invite them to the table to come and help us with plan design, making sure that we're reducing barriers for our members to get access to the best care.
And I love that story that you just told us, because to me it seems what I like about it is there's a problem, and it's about solving problems. It's about people getting better. It's about saving costs. It's finding ways to make it happen and for someone to be well, which I love. I wonder too, because you've mentioned partnerships. I don't know if people often see their insurance company as being a partner. Sometimes they might see them even as the enemy. So I loved your take on this and the idea that you like to work with your clients as partners.
Well, at Network Health, we're working hard to change that perception. You know, we're a different type of organization because we're owned by healthcare systems. So we see ourselves as part of that whole continuum, holistic approach to how we take care of our members. You know, I have another story if you're to hear about from a partnership. You know, we had a member that contacted one of our nurse case managers who was having trouble getting in to see a mental health therapist, and she was really struggling. And you know, they could have transferred her, but this nurse got on the phone and spent several hours finding a place where this member could get into an appointment that week because she sensed that she needed to get in. Several weeks later, the nurse case manager had a gift at the front desk with a note from this member that said, "Thank you for taking the extra time. You probably didn't know this, but you helped save a life." That's how we do things at Network Health. And a lot of it is because we are local. Our employees live and work in the communities. Our members are our neighbors, our family, our friends, and we really take an extra step to make sure that we are showing that partnership and trying to change the perception about how health insurance works and can support you.
Are you guys new? I hadn't heard of it before.
We aren't, but we are new to southeastern Wisconsin.
Gotcha.
We've been around for 35 years.
Okay.
We're a health plan that started back in the early 80s by a group of primary care physicians. We're currently owned by Ascension, Wisconsin and Freighter Health System.
Okay.
We've expanded into southeastern Wisconsin recently, 2016, into Kenosha. We have a new building in Brookfield that our members can come in and visit
is that
us.
it? That's
yes,
it?
yes, we're excited about that.
Yeah.
Because our members like to come in and visit with us because healthcare is complicated.
It
Yeah.
is.
And to
It's
be
confusing.
able, right, and technology is fantastic, but there's nothing that can replace someone sitting down
Face to
and
face.
face to face, walking through that information, and plus it gives me an opportunity to say thank you to our members when they come in. I love
like
it.
That's
cute.
neat. And remember, when you're on Medicare, I think sometimes people forget this, 65 and older, you have choices to make. And each year there are things like open enrollment, and people become eligible at different times of the year for different reasons. So make sure you know what your options are. This was wonderful to talk to you today. We appreciate your time. I want to share with people, especially because it's Public Health Week right now through April 8th, a great time to look and research your options. You can learn more about local health plan options by going to networkhealth.com. That's the website. Wonderful to meet you.
Thanks, Coreen.
Great. Thank you so much for having me.
Absolutely.